Hey, this is Vidi Troji, and I'm in a counseling mental health program. I am making my presentation about Portland Mental Health and Wellness Clinic. This is one of them. There are few in Portland, and so this is my video about it. This is the reception area, and these wonderful people agreed to answer my questions. Hello.
Hello.
This is Chris, HR manager, right?
That's right, yeah.
For the clinic. Thank you so much. So my first question would be, what is the mission of the clinic?
Yeah, I'm going to read it because it's a little long, but our mission is we aim to provide comprehensive mental health care grounded in the importance of curiosity, empathy, meaning-making, growth, the mind-body connection, relationships, dialogue, and collaboration. So that's our mission.
That sounds cool. Okay, my second question, what is the structure of your organization?
Yeah, we have, it's a little bit varying. So we have sort of our org chart would be a tree. If you could imagine a tree where you have sort of the ownership and our executive leadership down here in the trunk, and the admin team as well, sort of serving as the trunk. And then we have all these branches where we have outpatient services, we have intensive outpatient services, we have a training department, and we have outpatient psychiatric as well. So
Okay.
it's kind of a big
Liz, I'm
tree.
here to see Octavia and IT.
That sounds great. And I imagine that all those, they like cooperate, coordinate?
Yes, so there's a lot of cross collaboration with all the departments and all the teams. It kind of depends on the team, but there's a lot of outpatient therapists who will teach seminars for the student trainees. There is admin works with all of the departments as we're setting up processes and things like that. So there's a lot of, I would say the biggest example of clinical staff working as a team is going to be our IOP, the intensive outpatient programs, because they do group therapy. So there's multiple clinicians in the room at all times, and they're doing a lot of they meet every day that they have services and are talking through all of those problems together.
So those are clinical mental health counselors?
That's right, yeah.
And how do they collaborate with other?
It's in a
so
clinical
you have
sense.
Psychiatrists, right? And
We do, yeah, actually. So we have, it's a smaller team, but we do have, they're all currently psychiatric mental health nurse practitioners, so no psychiatrists at the moment. But there is some care coordination. So we have patients who sometimes get seen by therapists and psychiatric providers, and there's a lot of communicating between them to make sure that the care is the best it can be, yeah.
that sounds great. And then what kind of services, you kind of mentioned already, but if you can break down, sounds like you have group therapy, psychiatric, medical.
Yeah.
Like what kind of services, if you can break down?
Sure. Yeah, so primarily what we offer is just outpatient therapy, like psychotherapy one-on-one. We do offer some couples therapy, relationship therapy. We also offer services for children and adolescents, and occasionally family. It depends on the provider, so the provider gets to decide what services they're offering. So that's the bulk of what we offer, but our IOP also does, it's a program where you have group and individual therapy, and then our psychiatric services are primarily medication management. So it's not like hour-long sessions with a psychiatrist where it's therapy and medication. It's more of that medication management specifically.
Okay.
Yeah.
I see. Is there anything else? This is not a question from the class, but I'm adding it because there are always things that people know about their organizations that
Sure.
they may bring up that are not asked in a question. So
Yeah.
is there anything else that you can add about Portland Mental Health and
Sure.
Wellness
Yeah,
as an organization?
The main thing is that we have a big focus on training. So we all of our therapists are seeing patients all the time, but there's a really we have a whole department that's just about training people who are fresh out of school or still in school doing their practicum, and there's a really big focus on learning as a clinic. So sometimes you get referred to as a training clinic. That's not all we do, but it's a big focus. So that's a big thing. And then we also we have a couple different programs that are staffed by and serve specific populations. So we have a team that's it was actually grant funded, and it was to hire a team of queer, trans, and BIPOC clinicians to serve that population specifically. That's not to say their entire caseload are matching, but it's like specifically those underserved communities. And then similarly, we have a program. It's like another team of therapists that are bilingual, and specifically with Spanish speaking, because there's a lot of Spanish speaking folks out in the community who need services. Some of them only speak Spanish, so that was like another offering for a specific group that we offer.
That sounds great. So I could potentially do my internship here in a practicum if I want.
Yeah, I mean, you're in first year, second year?
I'm in my first year right now.
Yeah, we do internships. We have several master's interns starting on Monday, actually.
Oh,
Yeah.
that's so great.
Yeah,
Okay, that sounds terrific.
yeah, check us out.
And, I will. That's great. And for those, what therapies do you focus on?
One sec. I started to talk too much and I got dry. There's not like a specific like modality or anything like that.
Or what populations? Or
Yeah.
like what is the focus for those
Yeah.
interns?
Well, for the intern specifically, yeah, I think that still varies a little bit. We have like on staff, we have a lot of specialties in like Gestalt therapy, and but then we also have like sort of the general like CBT and DBT. Those are all modalities that this person or that person or this person has specific focuses in. I think we take a more like varied approach to it, so it's not teaching you one thing, it's how to use all the tools that you have in accessing which ones depending on what the patient needs. So I'd say like all of the therapists I know here are using a variety of different tools. They may, maybe one person has like an EMDR training that they're using. Maybe one person is using primarily just CBT frame.
Oh, great. So
Hey,
you have somatic too.
do we have somatic? I don't know.
sure.
You just said EMDR. That's
Yeah, well, I'm not a clinician, so I was like, I don't know. But
body based.
yes,
that
yeah.
is
So
EMDR.
it really depends on the clinician, though. So,
Yeah. Okay. Wow, that sounds great. Well, thank you so much, Chris. I'm
course.
super grateful.
Yes, of course.
And I may consider doing an internship.
Yeah, reach
here.
out. We'd be
I
happy
just, like-
we'd be happy to consider you for sure.
Okay. Thank you so much.